AMC clinical exam is a critical step for international medical graduates who are looking to practice medicine in Australia, although you can start working after step 1, but for most of the opportunities, it's recommended that you do the AMC clinical exam. However, what we have seen is the pass rate is quite low. Only around 20 to 22% of students pass every time. And many of them are actually the second time or third time candidates. So very few people actually pass in the first attempt. So what is the reason why this happens? Based on my own understanding and my interaction with the other candidates, what I've seen is the reason people fail is because of the wrong approach to the exam, not using the right materials for the preparation, and not doing the preparation in the effective manner and in a standard manner. What we need to know first thing is we have to first understand the structure of this exam, how this exam works, and how we need to prepare. And that's what I'm going to discuss in today's video. So AMC clinical examination. What we need to know about this exam is in this exam, you have 16 different stations. And in these 16 different stations, 2 stations will be the unscored pilot stations, which nobody knows which one they are. And the 14 would be the scored stations, and you have to pass 9 out of those 14 stations. It doesn't matter which subjects or streams you pass. That means there is no mandatory criteria for passing pediatrics or gynecology or physical examination or psychiatry and so on. So basically, if you pass 9 stations, regardless of which stations you pass, you'll pass the exam. So if you are a bit strategic, you can easily pass this exam. And to do that, the first step should be gathering the relevant information or gathering the standard practice materials. So what are the most commonly used practice materials by the international graduates? The first one is AMC Clinical Handbook. Now, this one was published more than 20 years ago, but this is still highly relevant even now. The reason for that is not the quality of the materials or the up-to-dateness of the guideline itself. It's because in this guideline, they have mentioned how they do your assessment. They have mentioned how the role players are instructed to answer your questions. They have mentioned what they consider the critical errors that you should not make, otherwise you will fail the exam. So that is the reason why, to understand their expectations from you, to understand how the role players will behave in the exam, to understand what are the criteria for your assessment, you have to go through this AMC handbook. Yes, some of the information are out of date now and you have to update that, and for that you'll be using the rest of the reference materials we have in this list. The second one, which is used by many international graduates, is JohnMA textbook. This is actually written for the general practitioners in Australia, but it can be a good revision book for those who want to get familiar with the Australian way of medical practice. And the book is quite easy to read. It's actually around, I think, 1400 pages long, but it's written in a very simple manner. This is written in a bullet point style, has got essential information about the history taking, examination you have to do, and so on. I personally did not read the book because I didn't have the time, and the other reason was when I tried to read the book, I didn't feel it that much engaging, but that's just me, because there are hundreds of others who have read this book and who have said that it was quite useful. Especially if you have used this book for your AMC 1 preparation, then I highly recommend that you go through this book. It doesn't matter if I didn't like it, you can still go through this book. This is a very good book as per the other candidates. Talio Connor's book is another standard reference material which is used for the AMC examination, especially for the physical examination stations, because in this book they have mentioned the Australian way of doing the examination. Most of the ways are standard and as we do in other countries, but there are certain things that they do differently here. So if you have any confusion, then you can go through the book. One point here, however, is that although this book is really good, one point that I would want to mention is the book is in 2 volumes now in its, I think, 8th or 9th edition. So if you don't have enough time, I don't recommend going through the whole book. It will take a lot of time and perhaps will not be that useful for passing the exam, because there are alternative resources you can use. However, if you have the digital copy of this book, use that as a backup. Especially when you feel confused about any particular points, you can go to the book and read about that part in detail rather than going through the whole book from cover to cover. The next one is the JohnMA Tax Peace and Education book. Now, this is not essential, but those of you whose communication skills are not that good and you do not know how to explain things in layman's terms, or if you have not practiced in Australia or you have not used English language for communication for that long, then I think this will be quite useful so that you understand what is the easy way to explain things to the patients, especially by using the Australian lingo. And let's say that gathering all this information and then distilling the information and preparing your own materials is time consuming for you, or you don't think you'll have enough time for that because you are a busy individual, you are working full time and you cannot commit that much amount of time for this, then I recommend that you go through the Learn Medicine courses. Learn Medicine courses contain all high-yield exam content with a proven track record. The question database covers 92% of the recent exam topics based on the candidate feedback. And this is based on the topics asked in the last 3 years of exam. So it has covered almost all the information that you need. So that generally it has the video followed by the revision notes, which are quite high yield, and they are based on the Sensel Australian resources. And this was prepared by me, a disclaimer for you. And I have made sure that I've used all my expertise in preparing this website. It has more than 700 videos. Each video is around 10 to 15 minutes long, and there are notes that you can read which are based on the Australian guidelines, and I think it will be highly valuable in your preparation. If you have any questions about this one, you can let me know in the comments. What are the other things you need to know when you are preparing the AMC exam? The important thing is the Australian guidelines are slightly different in some of the medical topics. Sometimes they follow slightly different approaches, slightly different standards. So you have to make sure that you are familiar with the Australian guidelines. The one that I highly recommend you should go through if you have time is the Australian Journal of General Practice. It provides peer-reviewed and evidence-based articles that reflect current Australian practice. It's freely accessible, so if you have time, go through these articles. If you don't want to read everything, at least try to read a couple of editions, the latest editions, because they have been sometimes used in the exam. The second one is especially for the pediatrics. Go through the Royal Children's Hospital guidelines. Again, they are freely accessible and they are the most valuable resources for the pediatric cases, with their clinical practice guidelines covering all aspects of the pediatrics cases asked in the exam. And the third one is the Royal Women's Hospitals guidelines. Again, it has a long list of different guidelines about the different obstetric and gynecological conditions, and that tells you what is the Australian way of doing these things based on the international recommendations. So you can go through them as well. They are available in PDF format, so you can download them and then use them as you like. Community Health Pathway is another resource that you can use. It needs username and password, but you can request that by going to the Community Health Pathway of your local health district, especially if you're already working as a general practitioner and you are preparing for the MC2 exam. This can be a very good resource for you to prepare for the exam because it tells you how to do the history taking, how to do the examination, what investigations to do, and how to do the management. And it is based on the standard that we follow in Australia. So it's, again, a valuable resource. Now, important thing is, as I said in the beginning, Australia uses a slightly different approach in some of the conditions management. So if you are not sure how that is done in Australia, then I recommend that you go through these references. Otherwise, if you are enrolled in any preparation courses, I guess they will cover this for you, like I have done in Learn Medicine, where I have made sure that I have used these guidelines, these references while preparing the materials. And that's why in every possible cases at the bottom of the notes, I have given you the references as well if you want to read more about that particular case. Physical examination is really important for your exam because in your exam, you might get 4 cases of physical examination. Sometimes it can be 3, sometimes it can be 5, but generally speaking, you will get around 4 cases of the physical examination. Now, if you think about this, if you pass all 4 cases of physical examination, you have only 5 cases left to pass from the rest of the subjects, from the medicine and surgery, psychiatry, pediatrics, and gynecology. So if you pass at least 1 from gynecology, at least 1 from psychiatry, pediatrics, and 2 from medicine and surgery, but you focus more on physical examination cases and pass all of them, you'll pass the exam. So my recommendation would be to start with the preparation of the physical examination cases by first refreshing your knowledge of the standard physical examination sequences and method. For that, you can use Geekymedics, which is very popular. They have hundreds of videos where they have explained how to do the examination of the different systems, how to elicit different spatial signs, and so on. So this will give you an idea about how it is done in the real practice. Talio Corner, which is the Australian textbook-based videos, can also give you an idea about how to do the examination, especially if there are any variations. If you have time, I recommend you watch this. And Stanford Medicine videos, physical examination videos, is another useful resource that can tell you about the examination techniques that aligns with the international international best practices, and you can modify that for the Australian healthcare system based on your understanding. So if you become familiar with the physical examination steps, then it will be easier for you to do the exam cases. Now, you have to be careful about one thing. Just because you know how to do the physical examination cases does not mean you'll be able to do the physical examination stations in the exam, because the exam stations are slightly different. They will not ask you to do the examination of the respiratory system. They'll give you a complaint. For example, you have a patient with pneumothorax. Now, just do the relevant examination. So you have to come up with that examination plan yourself. So the references like Geeky Medics, Talio Corner, Stanford Medicine will tell you what are the standard ways of doing the examination in respiratory cases. But Learn Medicine will tell you how to use that knowledge to answer the questions of the exam. So I recommend that you do the revision through the Learn Medicine physical examination course, or if you are enrolled in any other standard course, that should also be all right. However, make sure that you are not only familiar with the examination sequences and procedures, but you also know how to use that knowledge to elicit the particular signs in a patient presenting with a specific complaint. The next thing is, when you have done the first part, studying and refreshing your knowledge, the second part of your preparation should be your practice. So for that, you can find a study partner. They can be highly useful. And when you are looking for study partners, I recommend that you find someone who has compatible schedule, because you might be from a different time zone. Your study partner might be from a different time zone. So that may make it a bit difficult. Or maybe if both of you are working, that can create a problem as well. So make sure that you find someone who has compatible schedule with you. And the other thing is, don't try to do the role plays and study and the practices with the study partner every day, or don't use all of your time just doing that. What I suggest is, maybe in a week, allocate a few days, maybe 2 days, specifically for the discussions with the study partner. And that discussion will give you an idea about where you stand. And then based on that understanding, you can modify or customize your preparation strategy. The other thing is, if you find someone who has already booked the exam, who is in a similar situation, then it will be more useful. For example, if you have already tried the exam 2 times and your study partner is someone who is just starting now, then maybe it will be a bit difficult for you. At the same time, if let's say that you have already tried the exam 2 times and your study partner also has tried the exam 2 times, then it can be more valuable for you. It will be more efficient for you, because both of you already know a lot of things. So you'll be more focused when you'll be doing your study session. So find someone whose goals, whose circumstances match with you, whose time zone matches with you, whose schedule is compatible with you, and that way it will be easier for you to do your practice. Study timeline. How much should you prepare? That depends on your own background knowledge, how much you already know about the different topics of medicine. If you have already been working as a specialist, perhaps you will need to refresh your knowledge of the other streams of medicine as well. For example, if you're a surgeon, perhaps you'll have to learn about the medicine, you'll have to learn about gynecology, you'll have to learn about pediatrics. So you may need to spend extra time on that. If you have just passed medical school, then perhaps your knowledge is fresh, so it will take you less time. So these factors are important. So consider those things as well. The other thing is, if you're working full-time, you'll have less time to prepare. If you're working part-time, maybe you'll have more time to prepare. But generally speaking, if you are working full-time, then you may need 1 to 3 months of dedicated study. I was working full-time when I did this exam, and I studied for around 3 months. I prepared for around 3 months. I wouldn't have much time, but during my work days, I would be studying at least 2 hours to 3 hours, and then during my weekends, I would be studying long hours. If you're working part-time, perhaps you can do it in a shorter duration of time. And as I said, whether you need 3 months, you need 6 months, doesn't really matter. You have to decide that yourself, how much you understand the exam, how much you know about the cases asked in the exam, and how quickly you learn things. And based on that, you have to decide about how much time to spend. But most people spend around 3 months to 4 months. Then the other important thing is, as I said, AMC handbook is the most important reference for you. So make sure you read the AMC handbook at least once, and if possible, try to read it more than once. Customize your notes for yourself, write down your weak points, elaborate the things that you don't understand or you didn't know before while going through the AMC handbook. Extract the key points you got from the handbook that you think will help you in preparing for the exam. And if you are practicing the recalls, then organize the recalls by clusters. For example, if you want to use the recalls for your practice, then abdominal pain in women, and it's in the lower abdomen. What are the cases? Abdominal pain, epigastric pain. What are the cases? Abdominal pain in a child, what are the cases? If you do it in this way, then you'll make a more comprehensive approach to the exam. Don't try to memorize the diagnosis. It almost never works, and most of the times people fail if they do this. Rather, use the exam topics to update your understanding of the different topics, different diagnoses that have been asked in the exam, so that you can be aware of that, especially in your 2 minutes preparation time before you enter the room. And when you are about 1 month away from your actual exam, start doing the timed practice with your study partner. And when you are doing the timed practice, you have to remember how timing works in the exam. You get 10 minutes in total in the exam, 2 minutes for the reading this time, which happens outside the exam room. So just outside the exam room, you'll see the stem of the case, and you are given 2 minutes to read this time and to decide what you are going to do inside the exam room. So you have to know what to do in that 2 minutes. So always incorporate this in your practice, 2 minutes preparation, so that you can use the same strategy in the exam as well, or it becomes your second nature. Generally, what I would do in 2 minutes was I would usually think about the differentials of the presenting complaint. If it's a physical examination cases, I would think about the main system I would have to examine, some of the special tests I would have to do, and some of the differentials for the presenting complaint. Different people come up with different strategies here, but you should have a strategy. That's the point. So 2 minutes reading time. You should be able to read quickly and get idea about what you have been asked to do, including where you are and who you are. That means in a GP setting, are you in a hospital emergency, or are you a medical officer, are you a general practitioner? You should know that. You should know what is the demographic of the patient. You should know about the social circumstances of the patient. Patient lives close to the hospital, patient lives far from the hospital, patient does not have anyone to look after the rest of the family at home, or patient is a homeless patient who needs social support as well. Note these things when you're reading this time. And then think about the possible differentials, depending on what question you have been asked. At least try to think about 4 to 5 differentials, and then think about what you need to ask to make the diagnosis in that case. So practice the 2 minutes reading time. Then the 8 minutes performance time that you get in the exam. Don't use 8 minutes, use just 7 minutes, because when you go inside, when you greet the patient, when you ask a couple of things to start the case, you will consume your 1 minute. So usually you'll have only 7 minutes left. So make sure that you can finish the case in 7 minutes. Even in 7 minutes, make sure that you can finish the important tasks of the case in 6 minutes, and the last 1 minute for just wrapping up and brushing up things, which means you have to be very quick in your clinical reasoning. You have to be very efficient in asking the questions, and you should not be wasting any time in doing things which are not relevant to your case. And that is only possible if you do the regular role-playing sessions. Otherwise, time management will be your biggest hurdle. Most of the times people fail in the exam because they do not practice cases in the timed environment. So they know what they are supposed to do. They just can't finish in time, which could be because of not being able to ask the right question, wasting too much time asking irrelevant questions, or asking questions which are too long and not specific, doing the task which have not been asked in the exam, and so on. The next thing is make sure that you complete all the tasks. What I have seen is generally people spend a lot of time in the first 1 or 2 tasks, and then after that they have only a few minutes or sometimes even less than a minute left for the rest of the task. And if that happens, then you might fail the exam, because you may never know which task was actually the predominant assessment area of the exam. Every task in the exam has a predominant assessment area, and if you do not do that particular task, then you'll fail. So it's not that the first task in the exam was the most important one. You never know this kind of things. Although you get a rough idea that maybe if you have been asked to take history for 6 minutes and differential diagnosis in the 2 minutes, then you know that history taking is the predominant assessment area. But you can never be too sure about that. So make sure that you know how to judiciously use your time for different tasks given in the exam, and learn to complete all the tasks. And always practice in all the presenting complaints. Always practice thinking about the differential diagnosis. I had practiced this so many times that by the time I was, I think, a few days from the exam, I could tell the differential diagnosis of almost any presenting complaint. And when you're practicing the differential diagnosis, what you need to think about is what is the most relevant primary diagnosis based on the information you have got from the patient. And while making this diagnosis, did you ask all the questions to make the diagnosis? Especially if there are any criteria used to make the diagnosis, did you ask all the questions? For example, if it's IBS, irritable bowel syndrome, then you use Rome 4 criteria. If this is, let's say, major depressive disorder, then you are using DSM-5 criteria, and so on. In those cases, make sure that you've asked all the questions from those criteria. Second, try to think of at least 2 to 3 alternative diagnoses, and while thinking about them, think about their relevance to the presenting complaint of the patient in terms of the patient's gender, patient's age, patient's other demographic factors. Do not just randomly pick the differential diagnosis. And last one is always include at least 2 not to miss diagnosis. And this is important. Why? Because this way, if in the exam, let's say that you get a bit biased because of the recalls and you miss some important diagnosis, because of this particular strategy, you'll remember at least 2 differential diagnoses you should never miss. Because if you miss asking questions about the critical diagnosis, even if that's not your diagnosis in the exam, you are likely to fail the exam. For example, if you have a patient who has come to you with the complaint of headache and fever, and if you forget to ask about meningitis, you'll fail, because that's a diagnosis you should never miss. So just like that, in every presenting complaint, make a habit of thinking about 2 critical diagnoses that you should not miss. And the last point is, there is no point listing 10 differential diagnoses which are not relevant. Just including a large number of differential diagnoses is not going to help you to pass the exam. In fact, if you can list the differentials in the order of their likelihood, then you are more likely to pass the exam. So make a habit of thinking about the relevance of your differential diagnosis as well. On the exam day, when you are in the exam room, act like a doctor. Don't be a medical student there. Don't show your nervousness. Be confident. If there are things you do not know, be polite and say that. You'll have to look that up and find out. Yes, if you know, that is better. But if you don't know, rather than fumbling and acting nervously, you can be confident and act more professionally. Always make sure that you read the stem carefully before you enter the room. And when you enter the room, there will be a stem inside as well. So if you are not sure about the tasks or the information given to you, you can read one more time. Do not guess or assume anything. If you're not sure, read it again. You can also ask the examiner if you are not clear about any particular task, especially if the task uses any particular ideas that you are not sure how to do. If they are not allowed to tell you, they will not tell you anyway. So there is no harm in asking them if you are not sure whether you are supposed to do a particular thing or not. And always practice time. In the exam, you cannot use your watch. You cannot use anything where you can check time. So make sure that you develop a sense of timing when you have the conversation with the patient, because this is the biggest hurdle and this is the biggest reason people fail in the exam. Communication is really important. A lot of people focus more on the knowledge part, but don't focus enough on the communication, because for most of us, English is not the first language. So you have to make sure you can speak clearly. And in the exam, if your patients use any slangs, ask them what that means. It's fine to ask them what that means rather than making a mistake by guessing its meaning. Australians use a lot of slangs, and sometimes in the exam as well, they will use slangs, which is not to make your life difficult, but to check how you deal with that. So these are some of the things that I think are relevant and important for someone who is preparing for the AMC clinical exam. Of course, there are so many other things that you need to know, and I cannot summarize all of that. I cannot include all of that in just 15 to 20 minutes video. That's why I have created this platform called Learn Medicine, where I have included all the important topics, all the important things you need to know for the exam, and made sure that these are based on the local Australian guidelines. So if you are interested to find out more about this course, please go to learnmedicine.com.au, check the courses, and if you have any questions, you can ask me on Telegram, you can ask me in the comments. All the best for your exam. I'm sure you'll pass the exam, and one day we'll be working as colleagues.